Hello, this video has been created by Warwick Hospital maternity staff for families who have recently had a baby. This video contains information relevant to the first few days and weeks after giving birth. It includes information on the care you can expect to receive, information on normal changes that you and your baby may experience, and information on concerning changes and the actions we would advise you to take. Once at home, your care will be continued by community midwives, health visitors and your GP. Community midwives will visit you several times after leaving the hospital. These visits include the day after you leave hospital, when baby is 3 days old to weigh baby, when baby is 5 days old to complete the neonatal heel prick screening, when baby is 10 days old to weigh and discharge baby, and any additional visits you and your baby may need, for example feeding support. If you have not received your first visit by 4 p.m, please phone Bluebell Birth Centre to speak to a midwife. Your health visitor will visit by the time your baby is 2 weeks old. They will continue to care for you and your baby for the first few years of your baby's life. You will need to arrange an appointment with your GP for when your baby is 6 weeks old. Your GP will examine yourself and your baby to ensure you're both going through the normal changes expected after birth. This appointment is a good time to discuss contraception and to arrange outstanding cervical smear screening. For all parents, you will need to make an appointment at your local registry office to register your baby within 42 days of birth. Your registry office can advise of those who will need to attend and any additional paperwork based on your individual circumstances. For parents whose babies did not have a successful hearing test on the ward, you will receive an outpatient appointment. The first time you travel with your baby in the car is likely to be your journey home from the hospital. Before travelling, ensure you have safely fitted your car seat following the manufacturer's instructions. Your car seat must be appropriate for your baby's age and weight and be rear facing. Ideally, place your car seat in the back seat. If you do decide to place your car seat in the front seat, ensure airbags have been turned off. Remove padded clothing from your baby to ensure the car seat's internal straps fit correctly, placing any necessary blankets on afterwards. Please only use car seats for the length of your journey, as long periods in this position can restrict your baby's airway and isn't a good position for baby's neck and spine alignment. Once home, it is important that you follow recommendations regarding safe sleeping for your baby in order to reduce the risk of sudden infant death syndrome, also known as cot death. Place your baby on their back to sleep with their feet to the foot of the cot. Ensure there is nothing else in their cot. Your baby should sleep in this cot in your room until 6 months of age, keeping the room temperature between 16 and 20 degrees. Don't let your baby get too hot. Lightweight blankets are enough. To check your baby's temperature, feel their chest and not their extremities. Don't share a bed with your baby if you have been drinking alcohol, taken drugs or medications, are a smoker, you or your partner are very tired, or your baby is born prematurely or a low birth weight. Don't allow anyone to smoke near your baby. Anyone who does smoke needs to ensure they smoke outside, wash their hands afterwards, and remove outer clothing such as coats, jumpers, etc. where the smoke can linger. Further information can be found in the postnatal leaflet pack given to you from the hospital and online from the Lullaby Trust. You will notice lots of normal changes in your baby in the first few days and weeks of their life. Their stool colour changes from black to brown to green and eventually to a seedy yellow stool. They will not have a sleep or feed pattern initially, and their behaviour can frequently change. As long as they feed regularly and sleep often, no action is required. Caring for your newborn will initially centre around feeding, holding and comforting them, and their hygiene. Most babies do not require bathing initially. Top and tailing is an effective alternative. Ensure you have 2 separate pots with warm water. One is for baby's face and body, the other is for baby's bottom. Warm water is enough, soaps and shampoos are not needed. If you would like further information on bathing your baby, please ask your midwife. Ensure you change your baby's nappy promptly when it becomes wet or dirty. Cotton wool and water is all that is required. For little girls, ensure you always wipe from front to back to prevent urinary infections. For little boys, ensure their penis is pointing downwards in the nappy to prevent leaking. Ensure your baby's cord is placed over the top of their nappy so it can remain dry. Your baby's cord will naturally separate and drop off by around 7 to 10 days of age. If the cord becomes soiled, you can clean it with cotton wool and cool boiled water. However, routine cleaning is not required. Some parents notice discharge from their baby's eyes. If this is minimal, simply wipe away using cotton wool and cool boiled water. Wipe from the inside to the outside of their eye. Use each piece of cotton wool for one wipe only. If you're concerned about the discharge, please speak to your midwife. It is common for newborn babies to develop jaundice in the first few days of life. You may notice your baby's skin colour and the whites of their eyes has a yellow tinge to it. Your midwife will advise measuring your baby's jaundice levels using a monitor on their skin or by taking a blood sample from your baby's foot. Most newborn jaundice is harmless and resolves on its own within 10 to 14 days. For some babies, assistance is required to break down the jaundice using a light treatment known as phototherapy. If your baby starts to appear yellow, becomes sleepy or lethargic, or is not feeding regularly, then please inform your midwife urgently. It can sometimes be hard to know whether your baby is unwell and whether you need to contact healthcare professionals. If your baby has any of the following, then call 999 immediately. Your baby is breathing very fast, having difficulty breathing, or has stopped breathing. Your baby's temperature is abnormal, below 36 or above 38 degrees, and is unexplained by environmental factors. They may feel cold to touch or hot and sweaty. Your baby is floppy. Your baby has a fit or convulsion. Your baby's skin colour becomes mottled, bluish or pale, or they have a rash that does not fade when you press it. Your baby's behaviour changes, such as becoming very lethargic, difficult or unable to wake, unresponsive, having a high-pitched or weak cry or inconsolable crying, having a glazed, non-focused look, or your baby is not interested in feeding and having less wet nappies, any green vomit they have, or any blood in their stools. Please contact your midwife or GP if your baby is not feeding, vomiting repeatedly, or hasn't urinated for 12 hours. If you're concerned, then it is important to contact a healthcare professional. It is important for women to care for their own health needs after having a baby. Health professionals are here to help. If you have a perineal or abdominal wound, ensure you take regular painkillers such as paracetamol and ibuprofen, if they're suitable for you, and Oromorph if this has been provided for you. A cold compress, such as ice wrapped in a towel, can also help ease the pain. Do not apply ice directly to your skin. Keeping the area clean is important to promote healing. It is advised to bathe or shower daily, avoiding perfume products. It can be helpful to wear large maternity underwear and avoid tight-fitting clothing. Eating a healthy, balanced diet and staying hydrated will also help the healing process. If you have a cesarean wound, your wound will have a dressing on which your midwife will offer to remove for you, as they are designed to stay on for differing lengths of time, with some staying on for 7 days. Additionally, for the first few weeks, try to avoid lifting anything heavier than your baby. For perineal wounds, ensure you change your sanitary towel at least every 4 hours. All women should wash their hands both before and after changing their sanitary towel or going to the toilet, as this helps to prevent infection. Avoid standing or sitting for long periods, and do undertake your pelvic floor exercises. Please let your midwife or GP know if your wound pain increases, you notice redness or swelling around your wound, an offensive odour or any discharge or fluid leaking from your wound, or if you're feeling unwell. All women, regardless of how they gave birth to their babies, are advised to begin pelvic floor muscle exercises as soon as possible after birth. These exercises strengthen the layers of muscle in the base of your pelvis, which can weaken during pregnancy and childbirth. Strengthening these muscles supports your bladder, vagina and rectum, helping to stop and treat incontinence and prolapse. Try to perform pelvic floor exercises in different positions, such as lying, sitting and standing. Imagine you are trying to stop yourself passing urine or wind and squeeze and lift those muscles upwards. Make sure you are not sucking in your tummy or clenching your buttocks accidentally. Eventually your goal is to hold for 10 seconds, repeating 10 times and doing this 3 times a day. Physiotherapists have designed an app called Squeezy to help women with their pelvic floor exercises. If 6 weeks after childbirth you are not in full control of your bladder or bowel, or have pain or discomfort during sex, please let your GP know. Your routine 6-week postnatal checkup can be a good time. Your GP or health visitor can refer you to the women's health physiotherapists. This routine checkup with your GP also provides a good opportunity to discuss and arrange contraception, although you can see your GP sooner than 6 weeks if needed. Your periods may return as soon as 4 weeks after birth, and you will be able to conceive again. Exclusively breastfeeding may delay the return of your periods for several months, however you may still be fertile. All women are advised to use contraception, such as condoms, as soon as they resume sexual intercourse. Adjusting to caring for a new baby, pain and discomfort, loss of sleep and hormonal changes can all impact on your emotions. Many women find they feel tearful in the first few days after birth. This is referred to as the baby blues and is a normal response experienced by around 80% of new mothers. During this period, please do ask those close to you and your partner for help. Someone to cook, tidy, or do some laundry can be invaluable. Try not to overstretch yourself and think about limiting guests in the first few days and possibly weeks. For some women, the physiological, hormonal and lifestyle changes that happen after having a baby can lead to postnatal depression and other mental illnesses, including anxiety disorders and others stemming from a difficult birth. This can affect up to 10 to 15% of new mothers and can affect fathers too. Please let your GP, health visitor or midwife know if you have a persistent feeling of sadness or low mood, feel anxious, lonely or isolated, have lost interest in things that usually give you pleasure, have noticed a change in your appetite, or you have difficulty bonding with your baby. It may be that your partner or somebody close to you notices these signs and prompts you to seek help. Please contact Labour Ward immediately if you experience any of the following: a sudden heavy bleeding, a persistent increase in your bleeding, passing clots larger than a 50p piece, feeling lightheaded, faint or dizzy, or feeling that your heart is racing. If you experience fever, chills, shivering, abdominal pain, foul-smelling vaginal loss, and diarrhoea or vomiting. If you experience a headache in the first 72 hours alongside visual disturbances and nausea and vomiting. Or if you experience pain, redness and swelling in one or both of your legs, or shortness of breath or chest. If you cannot contact Labour Ward, please phone 999. You can also access Warwick Hospital's Patient Advice Liaison Services, PALS. This is a confidential service for patients and their families to help with any questions or concerns about the health services. You can contact the service directly by phone. Warwick Hospital also offers a birth experience listening service, providing women an opportunity to discuss the events surrounding their baby's birth. There is no time limit after the birth, however we recommend you wait at least 6 to 8 weeks so that you've had time to process what has happened. Thank you for watching. If you have any questions regarding this video, please speak to your midwife. From all of the staff at Warwick Hospital, we would like to congratulate you on the birth of your baby and wish you every happiness as a family.